I ensure that the room is safe as I approach my patients. I try to provide privacy by drawing the curtain. Then I perform my hand hygiene following WHO standard. I put an ample of gel on my hand. I rub my hand palm to the back of my hands with fingers interlaced, palm to palm with fingers interlaced, back of the fingers with fingers interlocked, tips of the fingers, rotation of thumb and my wrist. I wait for 30 seconds for my hands to dry, then I approach my patients. Hello, good afternoon. My name is Joy. I'm your community nurse sent here today to carry out observations on you as well as to ask you questions regarding activities of daily living. Is that okay by you?
That's all right. Welcome, nurse.
Thank you very much. Please, can you tell me your full name and your date of birth as I compare it with what I have on my chart here?
Hilary Jenkins with date of birth 1/1/1940.
All right, I have confirmed I'm with the right patient, Hilary Jenkins. Hilary Jenkins, how do you want me to call you?
You can call me Jenkins.
Oh, all right, that's nice. So, Jenkins, have you got any allergy?
Yes, I'm allergic to fish.
Oh, I'm so sorry to hear that. And what happens whenever you take fish?
Always have rashes all over my body. It's always terrible.
Oh, sorry to hear that. I just want to assure you that during my care, I'm not going to give you anything that contains fish. Is that okay?
That's all right.
All right. So, Jenkins, have you been resting for the past 30 minutes?
Yes, I've been in bed all day.
Oh, that's good to hear. Can you see and can you hear me well?
Yes, I can, nurse.
Very good. Are you comfortable at the moment?
Uh, should I say I'm comfortable? Can you just adjust this pillow at my back?
All right, it's all right. That's not a problem. Okay, here I've tried to raise up the pillow at your back. Is that better now?
Yeah, that's much better. Thank you, nurse.
All right, very much, Jenkins. I will just leave you for now to quickly go and gather the materials I will be needing for the procedure. In case you have any concern, just give me a shout, okay? I'm just close by, all right?
Okay, nurse.
Thank you very much. As I leave my patient's side, I perform another hand hygiene and I'm going to put on my apron and I'm going to put on my gloves. Assuming I've put on my apron and I've done my gloves, then Asato, can you please confirm to me that this apparatus has been calibrated within the last 24 hours according to hospital policy?
Yes, please.
All right, so I move my BP apparatus close to my patient's side and I perform my hand hygiene again. All right, Jenkins, I'm back. Are you still happy for me to continue with the procedure?
Yes, go ahead, nurse.
All right. So I will be starting the observations with your blood pressure. Is it okay if I make use of your right arm?
Go ahead.
All right. Thank you very much, Jenkins. So I can see that the arm is not swollen. There is no sign of inflammation or infection. I'm happy to use the arm. And I have ensured that I have the right cuff for my patients, the right BP cuff. So I'm going to tie it around about my patient's arm. Not too tight, not too loose, about 2 cm above the antecubital fossa. While that is measuring, I'm going to get my tympanic thermometer, attach a new probe cover to it. Jenkins, be making use of your right ear to check your temperature. Is that okay by you?
That's all right.
Can I touch the ear?
You can, nurse. You're doing your job.
All right, I can see that there is no hearing aid, there is no purulent discharge, there is no sign of inflammation or infection. I'm happy to use the ear. I insert my tympanic thermometer and it has beeped. Now that means that the temperature is taken. I take note of the reading and I discard the probe cover inside the clinical waste bin. So Jenkins, I just want you to try, I unwrap the BP cover as well, taking note of the reading. I want you to try and remain quiet for the next 2 minutes. Okay, I just quickly want to check your pulse rate. Is that all right?
Yeah, that's fine.
All right, I will be touching your right wrist now, okay?
Okay,
Right,
nurse.
thank you. I'm counting the pulse rate now. Assuming 2 minutes is gone. Oh, so Jenkins, I actually counted your pulse rate for 1 full minute, taking note of the rhythm, the pattern, and the rate of your pulse. I as well counted your respiration for another 1 full minute, taking note of the rising and the fall of your chest. I'm sorry, I didn't inform you earlier that I will be checking your respiration, and that is because I did not want the reading to be altered. Is that okay by you?
That's fine.
All right, thank you very much. I'm done with your observations now. I will just step aside to plot the observations and I'll be back shortly. In case you have any concern, just give me a shout, okay?
Okay, nurse.
As I leave my patient side, I perform my hand hygiene again and then I plot my observations on the observation chart, community observation chart. Assuming I am done with plotting the observations, I can see that there is another form here called Malnutrition Universal Screening Tool. Malnutrition Universal Screening Tool. So it has been pre-filled and I'm quickly going to calculate the whole total. And that is done. I have the total score of 2. Then go back to my patients. I have hand hygiene. Hello, Jenkins. I'm back. You all
Welcome,
right?
nurse. I'm
All
okay.
right.
Thank
So,
you.
well, your observations are all within normal range. There is nothing to worry about. However, I can see that there is a form here that has been pre-filled. Can you tell me, can you confirm to me that you were the one that actually filled this form? It is called a must form.
Yes, I feel that earlier.
Oh, that's good to hear. And I can see on this form that under BMI score, you have a score of 0. Under unplanned weight loss in last 3 to 6 months, you have a score of 2. Under acute disease effect score, you didn't score anything there. So the total score is 2, and that means that you are having high risk for malnutrition. But Jenkins, it's nothing to actually worry about because if you don't mind, I will be referring you to a dietitian for further plan of care. Is that all right by you?
That's fine by me. Thank you, nurse.
I just all right, that's good to hear. I just want to ask, do you have any food preference?
Yes, I love to eat chocolate.
Oh, chocolate. All right, chocolate is not bad, Jenkins. However, there are other healthy choices of food that you can choose from. If you don't mind, as I said earlier, I'll be referring you to a dietitian. And as regards other questions concerning activities of daily living that I said I'm going to be asking you, do you have any problem mobilizing, or have you
Uh,
had any issue of force?
yeah, I can't count the number of times I have fallen, and I'm so scared, nurse. I don't even want to get out of this bed. It's so scary.
Oh, I'm so sorry to hear that, Hilaris. I just want to advise you that anytime you want to mobilize, just try to put on your anti-slip socks, okay? Or any appropriate footwear in order to prevent further fall, okay? And we advise you that you should try and make your environment to be free from anything that can actually make you to slip or fall. And immediate needs as well. You can things you feel you use more, you can put them beside you within your reach in order to minimize your moving around. And if you don't mind, I will be referring you to a physiotherapist as well as occupational therapist for further plan of care. Is that all right?
Oh, okay, nurse. Thank you. I
Welcome.
feel more
We've
good
already
now.
talked about your nutrition and hydration. I don't know if you have any other concern, maybe with your sleeping or your elimination. Do you have further concern?
No, not at all, nurse.
All right. Thank you so much, Jenkins, for your participation. I will be leaving you for now. I believe you have your GP number with you, right?
Yes, yeah, it should be my diary. Yeah.
Oh, okay, that's good. In case you have any questions or any further questions or any concern, you can ring your GP. And if you feel you have a case that is life-threatening, you can call emergency number. All right.
Okay, nurse. Thank
Thank you
you.
very much. I'm going to leave you for now. Bye for now. Thank you. I
Thank you,
perform my
nurse.
hand again.